Hi, my name is Dr. Mike Scott. I'm a physical therapist here in Los Angeles, California, and today we're going over 4 neck stretches that are going to help relieve you of your neck pain, tension, and stiffness and allow you to get back to the activities that you love. If you hang around till the end, we're going to go over my #1 neck exercise that can also help relieve pain but also prevent it from coming back in the future. Let's get started. And the best thing about all these stretches and exercises is that you need no equipment, just your body and maybe a chair to sit in, so you can do them at the office, at home, or even at school. So the neck moves in 3 planes of motion. We have forward and back, side to side, and rotation. And to stretch the muscles of the neck, we're going to need to take them through all of those different planes of movement. And so today, the first stretch that we're going to be doing is probably the one that most people are familiar with, and that is an upper trap stretch. And the upper trap, or trapezius, are the muscles that sit kind of on the sides of our neck and a little bit on the caps of our shoulders. And so to do this, we're going to be tilting our head away from the painful side. So if my right side of my neck hurts, I'm going to be tilting my head to the left while taking my left hand and applying a little overpressure. And so we're going to be holding each stretch today for 30 seconds. So we have our head tilted to the side, just feeling a nice gentle stretch. So a lot of times these upper trap muscles get tight because they can shrug our shoulders, which a lot of us will do if we're stressed or maybe if we have our elbows supported throughout our day on our desks. We have 10 seconds left, and then we're going to shift over to the other side, just in case the other side is bothering you a little bit. And like I said, okay, we're going to be doing both sides. So if it's the left side of my neck that's tight, I'm going to tilt my head to the right, and I'm going to pull with a little bit of gentle overpressure, feeling a stretch anywhere from the base of your skull all the way possibly to the tip of your shoulder. And I'm going to have to guess on these 30 seconds, but we'll be kind of close. You guys are going to have a timer at home on the screen, so just follow along with that. And you can actually hold these stretches up to 60 seconds. And so we're just stretching along. And I give these stretches out every single day to people. Good. To help with their pain, stiffness, achiness that they have in their neck. And so we have our upper traps, and right next to our upper traps, another muscle that helps shrug our shoulders and might have a little bit of tension or stiffness in it are our levator scapula muscles. And it kind of does what it sounds like. It elevates the shoulder blades, kind of like the upper trapezius. Now they do play a role in what our shoulder blades are doing as far as rotation goes, but for the most part, for today's purposes, we can think about them going up and down. So to do this, it's going to be very similar to what we were doing for the upper trap stretch. We're going to tilt our head away, but we're also going to turn our head away from the side that hurts. So once again, if it's my right side, I'm going to turn my head to the left and pull to the left. And we're going to be holding for 30 seconds. And so you're kind of like looking past your armpit here, and you'll feel a stretch on the outside. It's going to be a little bit different than the upper trap stretch. And you might say, oh man, this is a lot more intense than that last one. And that's probably because that muscle might be a little bit more tight on you. Now we have about 10 more seconds before we switch sides. And just like always, you want stretching to be something that you want to do again. You don't want it to be something that's so painful that you can't imagine doing it again, okay? And so for me, I feel a little bit more stretch when I stretch the right side of my neck than the left side. And so if I'm in a pinch for time, I'm probably going to just spend a little bit more time on that right side stretching than the left side. And we have about 5 more seconds left or so, maybe a little bit more. All right. Great. And if you need a little rule of thumb for what might be too intense of a stretch, if you're holding your breath, if you're panic breathing, huffing and puffing, just from stretching, you're definitely stretching a little bit too aggressively, and you're going to want to back off a little bit. I'm not saying to stop unless it's really painful, but you might want to lay off the stretch just a little bit. All right, so we're gonna shift gears and go away from the side and the back of the neck to a little bit more in front, to a muscle that we'll just call our SCM. Now this guy does rotate our head, it flexes our head down, and plays other roles in side bending as well. So there's a lot going on with this. So if I want to stretch the right side of my neck, this big guy right in the front, I'm gonna have to tilt my head up and away. It's kind of like the opposite of that levator scap stretch. And so what we're gonna be doing is we tilt our head up, and you might already feel a stretch, and then you're gonna look away. Now I'm gonna do my best to keep us to 30 seconds here. And you'll feel that stretch. You might even feel it all the way up into your jaw, but coming down the front and the side of your neck. You're gonna wanna try to keep your teeth together while you do this. I know I'm talking, so I'm not doing that, but you're gonna do that at home. And you hold for 30 to 60 seconds. We have 5 more seconds. And now we're gonna tilt away, so still tilted back and tilted away. Got my watch here, just to make sure I keep us in check, about 30 seconds or so. Just deeply breathing. Once again, teeth stay together, trying to relieve some of that tension in your neck. Now, if it hurts to tilt your head back, you can just come a little bit more to the side, but you want to try to tilt your head back as far as you can. Obviously, if you've had vertigo, you're going to want to be mindful or careful of this, but that allows us to stretch out the front. And when we've had maybe a forward head posture for a really long time, we can put a lot of stress through those anterior or front muscles of our neck. Okay, the last stretch that we're going to be doing before we get to the bonus exercise is going to be a rhomboid stretch. Now the rhomboids actually move the shoulder blades around a lot. However, they can refer pain up into the neck. So we might want to try to stretch these guys if you're feeling some pain or tightness up into the neck. Now if I'm once again stretching out the right side of my upper back and neck, I'm going to take my right elbow and my left hand, and I'm gonna push them into each other. So they're kind of meeting the resistance in the middle. No movement is occurring, but I'm pushing. And then I'm gonna turn away from my painful side. So if it's my right, I'm turning to my left again. Now I'm gonna keep an eye on the clock to once again hold for 30 seconds. But you want your head to turn with your shoulders as you go. Once again, just deeply breathing, always pushing into each other. And if you need to take that quick break, maybe you're getting a little tired, feel free, but just keep pushing after you've taken maybe a 1 or 2 second break. And you can turn a little bit more and a little bit more, and you'll feel that stretch right between your shoulder blades, between your spine and the edge of your shoulder blade, I should say. Okay, so we've gone a little bit longer than 30 on that side. So I take my elbow in my hand, I push them into each other, and now I'm turning, trying to get my watch all set up here. I feel that stretch right between my left shoulder blade and my spine. Feels great, actually. Just breathing, take a break if you need to, but just re-push and turn. And we have 10 seconds left before we get to our bonus exercise that can help relieve some of the tension and pain and prevent it from coming back. Okay. So the bonus exercise that we're going to be doing is a combination of 2 movements. The first being a chin tuck, and the second being a side bend, similar to what we did for our upper trap stretch. The chin tuck is a backwards translation of the head. And what that means is from the side is I'm not tucking my chin down, I'm actually moving my head backwards. And the easiest way to do this, where I like to cue people, is you basically put your hand on your chest where your fingers are also touching your chin, and then you try to move away from your fingers. And you'll see I've created that gap between my fingers and my chin. That's the first part of the move. And now what that does is it opens up the space in the back of our head called our suboccipital triangle. It stretches these tiny little muscles out that we have back there that kind of move our head around, or our skull around on our neck. It can help stretch those out, take some of the tension out of those muscles. And then if it's the right side of my neck, what I'm going to do is I'm going to tuck and I'm going to tilt towards the side of the pain. With the stretching, we stretched away from the pain, but when we're exercising, if we haven't been able to get relief from those stretches, sometimes moving towards the pain can actually be very beneficial, especially when we have done this tuck. So what we're going to do, we're going to tuck away and then tilt. And then we're going to reset. Tuck and tilt. And so you keep that tuck the whole time. And you're kind of going to give yourself a real gnarly double chin. And chances are, the better the double chin, the better you're doing it. But remember, we're not tilting our head down to do it. We're bringing our head back from the side once again. Back and down. And you're just going to do between 5 and 10 of those. If you really want to do these throughout your day, you can do between 5 and 10 every hour on the hour. You can't necessarily do too many of them, but you can do it too intensely. So you want it to be comfortable, something that you want to do again. I hope you found this video extremely helpful in relieving your neck pain and stiffness. And if you never want to miss another rehab video like this one, please hit the subscribe button so you can have all of my content directly delivered to you. Thanks for watching.